Okay, great. Welcome, everybody. It is so nice to have you all here again. I wish I could say that we were discussing how COVID impacted our lives in the past, but we are once again looking at how COVID is impacting us in our jobs, as well as our world and how we're moving forward. We have Dr. Breena Holmes here with us today to answer some questions. She'll briefly bring us up to date and then start answering as many of the questions that we have received as time allows. And we will continue to get the answers to the unanswered questions as soon as we are able to do that. The focus of today is going to be primarily on what you as school nurses need to know for the next 2 weeks. And Breena, it's all yours. Thank you again for joining us today.
Is Breena, oh, you know what? I muted her phone, so give me 1 second here. What was the last 4 digits of her number? No, I got it. Yep. Okay, Dr. Holmes, you should be good now.
Phew.
Sorry.
Hey, that was kind of funny. Okay, hi everyone. I just wanted to start by telling you we're going to go through some material very quickly, but it's the crux of all of this is your questions. And I'm so grateful for your VSSNA leadership and Sharon Lee Treffry, who have pulled the questions together, put them onto very dense slides so that we can capture and continue to be responsive to the real life implementation that you're all in the center of, and we're grateful. So I always start with gratitude because this is a very complex time. Yeah, sometimes it's hard to remember what our lives were like before March, and I do like to just take a breath and ground us all together in this moment, that we are an extraordinary state loaded with people who have a shared goal of getting schools open, and no one should be feeling that they're trying to do this alone. I also begin by reminding us that since the last time we spoke, we have learned so much more about this virus, in particular how it impacts or does not impact children. And I want us to continue to stay humble in the science, that there may be things I tell you today that I need to come back and correct, and some of the answers to the questions may develop, and there may be different answers in the weeks ahead. So a couple guiding principles or concepts today. There's been a lot of talk about the interface between the guidance that we produced from our task force for safe and healthy schools and school districts, school and supervisory unions and independent schools implementation of the guidance. I would call this kind of a not winnable situation where some folks prefer local autonomy and decision making. Others have been very vocal and spoke of the need for a statewide approach. And we on the task force acknowledge that we're living in that space of lots of different opinions about how to move forward. So we're currently still seeing our role as very strong guidance that has some implementation style at the school district supervisory union or independent school level. The other thing that those of you who know me know that I spend a lot of time in quality improvement, and I really like plan, do, study, and act, PDSA, as a concept in our work. You are all so deeply invested in planning right now. We've been planning since March, we've been planning since June, we've been planning since July. So plan, 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 and I really feel that at some point we need to move into do. And I just wanted to reassure you that when you start, we will be here to study, to measure, and to revise and to act, which in quality improvement means to change the way we guide based on your experience. And then the last thing that comes up a lot that's a key concept is all of us in Vermont need to follow public health guidance about mitigation strategies to keep our communities healthy, to keep transmission low, so that schools will be safe. So this is an all-in phenomenon. It's not just about schools. Here is the link to the guidance. We are revising it next week. It's almost done. Therefore, we stay very wed to the link, not to any PDF, because the links will become updated in the early part of next week. I also think most of you know we have a PowerPoint on our website we created that's free for you to use. I don't mean free cost, I meant it's available, and we really, we've heard that superintendents and pediatricians and school nurses are using a shared slide deck to talk at the local level about the guidance. So when the pieces we revise for next week in the guidance will be reflected in a new PowerPoint. So let's also start today with what we've learned since we last spoke. I'm calling this slide Science, Pediatricians, Infectious Disease Specialists, and Vermont. I hope you saw that on Monday, the American Academy of Pediatrics Vermont chapter came out with a very strong press release about the science. We also have incredible pediatric infectious disease doctors who read every study every day all around the world. And I want to remind us as we digest media that Vermont is different than any other state in the country for its response to the virus, and also how we have kept community transmission to be the lowest in the country. So children are less likely to become infected with this virus. Children are less likely to develop severe disease. And critically, children, particularly younger children, seem less likely to transmit this virus. Countries with low prevalence of COVID, similar to Vermont, have successfully opened schools without outbreaks. So it's, please do not compare us to Texas or Florida or other states that are not containing the virus. My national school health colleagues are working to open schools around the country with a 5% positive test rate. We have not been above 1% for how many tests are positive in weeks. And we had a brief time, we were above 1% during the Winooski outbreak. A reminder of the very deep representation on our amazing task force. We also shared the guidance with teachers, parents, youth, and some additional pediatricians to make sure we were representing the experience of rural students. And a reminder of our objectives. And the first three are a very important frame for our health colleagues and you all on the call to remind yourself of, so we can get organized in this when we feel overwhelmed. We have to stop the virus from getting in the building, and that's health screenings and staying home when you're sick. You have to stop the virus from spreading between people in buildings, and that's masks, cleaning, and distancing when possible. And you have to figure out when someone has COVID, isolate them, test them, and contact trace, which I will say just for the sake of this call, and it will come up in questions, that is the part that we have the most handle on as a state in terms of our ability to test and contact trace. And the task force and others have never, including you, have never lost sight of the important special needs of students. We continue to know that communication with all of us over and over between staff, students, families, and community is essential. And we're a great state to remind each other always of equity. Okay, I'm diving right into your questions, and they came in groups, and we're actually very aware now of themes and where the sticking points remain as you try to interpret the guidance. So the CDC did not say no daily screens. They said that they're not done at school. That's a big distinction. So the task force is grappling with this right now, but we are leaning toward symptom screening at home, but temperature screening still in first point of contact, which would be the bus or the school building. So that's a preview, and it will be finalized next week. But please make a distinction. The CDC's guidance did not remove screening. It said not to do them at school. What about the limitations of no-touch thermometers outside in the cold and sweat? We're aware of that, and we encourage people to know their package inserts and to continue to use them because they're the best we have. And I know there's a lot of debate, especially in our health field, about thermometers or taking temperatures as part of our school guidance. Our infectious disease doctors are 100% sure this should be part of our screen, and I stand with them. We don't have a lot of objective things we can do in COVID, and this has worked well in childcare, it's worked well in summer camps, and it works well in employment. So we're sticking with it. Documentation requirements around the health screenings, we're not speaking to that directly in the guidance. And schools are creating their own tools. Most schools are talking about a symptom screening piece of paper that families will sign. My child does not have these symptoms. And yes, staff are all self-screening. And again, schools will decide if they want their teachers to sign what they call self-attestation, or just say that they don't have symptoms. We have talked a lot about HIPAA, mostly HIPAA, not FERPA, if a screener is asking in front of others. What we've done in childcare and camp is distance, 6 feet, while you're being asked quietly, so there isn't a witness or an overheard description. Is daily health screening once a day or when people leave the building? People shouldn't leave the building. If people are leaving and returning, they should be screened again. And I was interested in that question because I'm wondering where the people are going, but maybe the person with that question can reach out to me directly. And what about notes from primary care or negative test results if patient is positive? So I have a lot to say about this. I'm going to go to the next slide. So I was wrong about that. Okay. At 3:30 today, I have to leave you to meet with a group of pediatricians and pediatric infectious disease doctors to get a draft algorithm in place for return to school after you've had symptoms. So there's really 3 pathways, and national algorithms are being produced. We like our own, we like making our own in Vermont. We're planning to bring it to school nurse leadership for sign off before it's final. So the pathways are, if you have symptoms consistent with COVID and the decision is made to test, then yes, schools would need to know the test was negative for return. And there's very clear return guidance on if you have COVID. If you're positive, it's all written up, but you have to be fever-free and you have to have gone 10 days since your first symptoms. The COVID symptom list is extensive and long, and it incorporates almost every type of illness symptom you'll see in children, which is complicated but true. So if children have COVID symptoms but no one thinks it's COVID, with a medical home school nurse discussion, return to school is going to have to rely on resolution of symptoms with some guideline. And then the third path would be someone leaves school sick, but no one ever really worried at all about COVID. And that's when your school nurses use traditional return to school guidance. So I didn't mean to overtalk that because the algorithm will make this much clearer, but there are certain topics within your questions. I just really reassure you that we're going to have really solid tools for you. So it's not left up to all sorts of community decisions. That being said, it's the 30th of July and I know you're ready, and so are we. So we're moving quickly. Okay, this next group of questions is about bus drivers and COVID coordinators. This person is seeking some guidance for bus drivers, particularly recognizing many are older. I fully support this and I'm aware of this. The plexiglass divider right now is not on the table. what's on the table is good ventilation on the bus, windows open when driving, and a mask on everyone. So there's a big decision at the local level whether buses will have a bus monitor. And in areas where that's occurring, the bus driver stays separate from students. And in the event that there isn't a bus monitor, bus drivers will need to discuss their risk for COVID based on their age, their health, and discuss that with their medical provider. So I think this would also be an important conversation with school administration. Recommendations on how to modify PE, art, and shared implement supplies, chorus, band. Each one of those has its own approach. Chorus and band with woodwind or any respiratory effort is not allowed in our current guidance. We've been asked a lot about if you can go outside and sing, and with proper distancing and truly outside, we're certainly not limiting that. Shared materials are addressed in the guidance. We do need to have each student have his own materials. If you do need to share, they should be cleaned and passed along. That's true of books as well. And PE is not currently in our the first phase of our guidance, which is to come in without PE and figure out how the school is functioning, and if folks want to bring forth PE, there is an allowance for that in the guidance, but it would need to follow all the same mitigation strategies of distance and mask. There's a lot of questions in this one question. Different approaches for high school in areas given teenagers spread. That absolutely, we are. You will see in the revision of the guidance that we have taken the data into account about the difference in the way that kids spread the disease. I will say teenagers have been shown to have more transmission than little kids, but not as much transmission as adults. So we have to be very careful in how we talk to each other about this. One of the true facts of COVID is each decade of your life adds more transmission. If the long-term impacts of COVID on our health is unknown, how can we presume it's safe to go back to school? Please discuss the risk. So it is absolutely true that there is risk in contracting COVID in our society right now, but schools do not present any increased risk because we're working so hard on the mitigation strategies, and kids themselves are not responsible for this pandemic, which is really different for us as pediatric folks and school nurses. We're used to viruses spreading from children to adults, and this disease does not work that way. So the risk of COVID for all of us exists in our community behaviors, our socializing, our moving about in the world, and there is nothing inherently riskier about schools. In fact, many infectious disease folks put forth the assertion that because you're working so hard on keeping the virus out and not spreading it when you're in the building, that it is safer than other community settings. Please clarify why universal testing will not be offered on a regular basis. So universal testing of asymptomatic people is not recommended by public health. And the reason is it's one moment in time that you don't have the virus if it comes back negative. There's some studies that show people that get a negative test decrease their mitigation strategies and stop thinking they need to stay home when sick, taking their masks off. So it actually is counterproductive. And it's also, we have such low prevalence of the disease that it would not pick up, it would pick up an absolute microscopic amount of virus. So we have done some universal testing in Vermont. Some of the healthcare providers have been doing it. We've been doing it for what's called pre-procedure. If you're going in to have an elective procedure, and it has yielded no tests. So the current recommendation is no universal testing. Some summer programs currently running in the state requiring regular testing. How to guarantee this not be risk associated with entry? Don't know what that means. Currently running in the state that are requiring regular testing. I'm not familiar with those. Residential programs like overnight camp is different. Requiring testing of people who travel from out of state to come to be in Vermont is recommended, and that's quarantine testing. That's different than universal. And I just really think through with me the science. If you test a bunch of people on Monday and they don't have COVID, you'd have to test them Tuesday and Wednesday and Thursday, right? Because there is no, it doesn't give you a, what's, you know, a viral free pass. It would be really important to communicate that. Which documents should we use for restarting school? We have AOE, CDC, and AAP at this point. Oh, please use the Vermont Department of Health and the Agency of Education guidance. Our intent and what we were able to do is to review everything in the CDC, everything in the AAP, put it through the extraordinary minds of the task force and all the people, and produce our own guidance. And that's why we got back together this week to revise, because we felt there were some changes in our state and national approach that needed to be addressed. My district has opted to have all grade levels open at stage 2, hybrid learning with only half the students, now that they're urging from Vermont AAP to send them back. My superintendent would like very specific guidance. Is it going to be 3 feet? Are we calling this stage 3? Okay. So this is super important and a little complicated. Vermont has been in stage 3 since May, early May. But the task force was very thoughtful that we need to set up schools in stage 2 so that we figure that out, get that right, move to stage 3, but know that we can function back in 2 if we need to step down or back based on data. I hope that's clear in the guidance. We try to explain that in the guidance. I think it is solid, but if it needs more clarity, let me know. Therefore, your school's decision about how to teach was, that was pretty well documented in the news. Each school looked at our guidance and made decisions at the local level. So then, as you note, the AAP spoke very clearly about the science that kids don't transmit this virus under grade 5, and they are urging some rethinking of plans, which schools were planning to do all along. Our understanding from talking with superintendent leadership is that plans needed to get out for folks to start thinking about the start date, which is now September 8th. But there was nothing in the plans I saw that said this is forever or this is for the whole fall. And the hybrid learning is where a lot are starting. And I'm hopeful that the data and the ongoing support of the medical field will lead to more face-to-face learning for our youngest. Stay tuned for the 3, 4, 5, 6 foot discussion. It's very much in the center of the task force, and we're bringing the best thinking and science forth, and there will be some revision in the document about distance. That's all I can say today. Okay, this is also a really important critical part of our conversation, which is about PPE. We know that there are children with special health needs and educational needs, and that will lead to some staff needing more than a cloth covering. You are so lucky to have Sharon Lee Treffery in your midst, because she has used supply grids from Massachusetts and others to work closely with the State Emergency Operations Center and AOE to make sure we can anticipate the needs of school nurses and others in our schools. So there's guidance coming out about special educational needs of children, and we're going to include some specific guidance in our revision of the task force guidance. Just a paragraph to say there are special situations that require more protection. It's really going to be adding goggles to folks that already have on cloth coverings in settings where students are unable to follow public health strategies. Sharon Lee is also available to all of you for outreach about the fit testing question. There are times school nurses are going to need the N95 mask, and we do want communities to support school nurses in their need for fit testing. I'm not going to go much further on this because I think at the end, if there's time, Sharon Lee should tell you about which procedures and which students, and there's some very specific guidance about the symptoms. And the supplies for district, whoops, I'm really hopeful that this is a robust response, and I've heard great things about our supply chain, what's ready for schools. And if you aren't a part of those conversations, I would really encourage you to ask someone in your school district who's in charge of procurement, because I think it's going well, but if it's not, we'd like to know. Should we require a doctor's note for mask exemption? I'm worried about my community's response. What we're currently encouraging is team-based care. We want parents, students, school nurses, special educators, and medical homes to think about individuals' cases and students about their capacity to wear a mask. We haven't gone so far as to require a note. We want it to be part of an individual plan as it relates to the intersection of health and education. And I think you follow all the same worlds that I do, but there are very few medical reasons to not wear a mask, but there are several social, emotional, and behavioral reasons. Okay, please clarify the requirements for pre-K mask wearing. The language is different. That is true. We've been acknowledging this since June that we recommend mask wearing in childcare and summer camp. And when we met with the educational leadership and developed school guidance, the decision was made to make it required, which left pre-K students in a bubble between two guidance documents, which I do not prefer discordance. However, we say very clearly in both guidance documents that developmental considerations are paramount and that 3- and 4-year-olds need special consideration. So do pre-K students, should they wear masks? They should try. One of the most heartening parts of this response to date is childcare providers and little kids and their efforts to get kids to wear masks and cloth coverings. And there's great pictures, there's great examples, and we have a ton to learn from our childcare providers and summer camp leadership in how to make this a part of our society. We have several staff members who are making cloth coverings with clear mouth sections of vinyl. Are there specific specs that need to be followed? No, as long as it's not a porous, we don't, obviously cloth is porous, and anything less porous than cloth I wouldn't want in that center. So again, we're not engineers, but we are offering if folks want to show us what they've made or have questions about the materials for the cutout. I love innovation, and I think it's remarkable what people are working on right now. Staff that work directly with students are not nurses are asking for more PPE than face masks. Yeah, I think I had just addressed that on a previous slide, that we recognize there will be other adults who will be in special circumstances and may require goggles. And then this is sort of a subsidiary, the question here about N95s for teachers. Yeah, we've got some advocacy going around that. It's a good idea, and we're looking at supply chains for that as well. We're providing snap-up scrub jackets for our pre-K providers. Yeah, I mean, I think those types of innovations in what we wear and what would make people feel safer are all being considered. And I do think the National Academy of Science, which is one of the many, many great organizations that's looked at research and restarting schools, is supporting N95s for teachers. So we're exploring it as well. Will students be allowed to be outside at recess without masks? Yes, if they can maintain 6 feet. So our childcare and summer camp guidance addresses this, and we also have it in our school guidance that everyone needs breaks, and the way to do a break safely is by getting more than 6 feet apart outdoors. So the screen sharing thing there, it needs to go away. Inside, if students are wearing masks, do we need plexiglass or other device? Are wearing masks? Do we also need plexiglass? No. If everyone's masked and working on the distance, plexiglass is extra. I'm concerned with increased hand-to-face contact when wearing masks. They create moisture, irritation, itchy. Absolutely true. The good news about what we've learned in childcare and summer camps is kids touch the outside, and that's okay, because that's not the part where the viral particles are, you know, if there were any accumulating. So kids do touch their masks, and but they're getting used to them. And if, again, individualized care here, if there are students that cannot stop touching their masks or sucking on them, we have a lot of little kids who bring them in with inhalation, then those are students that are going to need special accommodation. Hopefully just frequent changing of masks, but there are, again, very rarely kids who can't tolerate them at all. Face shields may be more comfortable to wear, decreasing the need for covering. Okay, so face shields have been up and down throughout the 5 months. They are an allowable alternative to masks, but in our school guidance, we don't want them for children because it's just a whole other journey to prevent the particles from spreading. We feel like adults, if they can't tolerate a mask, can try the shields. The studies on face shields are, they prevent the virus from coming out of your mouth, but they prevent the virus from coming in, but they may not prevent you from spreading it because the particles could drip down. But there's, you know, a lot of states, and Vermont included, are saying it's a allowable alternative. And then Clear Mask brand, you know, we don't endorse brands, but I am familiar with this product and it is acceptable. Okay, I think I addressed this. Oh no, this is a little different. So 6 foot, you know, stay tuned for revision of guidance, a hot topic. But this is an important time for me to tell you that contact tracing and decisions about who is a close contact of a person with COVID is truly done case by case. There's almost nothing we can put out to you all that's going to explain, in the event of a positive case, who's going to be called and asked to quarantine as a close contact. So in general, it's for more than 15 minutes, the person who asked this question is correct, and less than 6 feet. So that's the general guidance. But what happens is, if the person who has COVID is symptomatic and had some types of behaviors associated with the symptoms, the contact tracers are going to find, they're going to want to know more about that person's movement. But if the person had very minimal symptoms, had a mask on always, they're going to identify very few contacts. It's really been one of the most interesting learning curves for all of us, is to not make any assumptions when you hear that someone has COVID. So they will be, in the scenario listed here, 6 feet or less, more than 15 minutes, the contact tracer will recommend quarantine. But the best part for all of us, you as school leaders and school nurses, you don't have to do any of this. This is 100% determined by the interview with the person who's positive. And we have just a smattering of experience with this from childcare providers and summer camp staff, like under 10 adults who have come down with COVID from a community acquisition that then went to work in a child serving setting. So it's really important that you hear what I just said. They did not contract the virus in the child serving setting. They brought it to the setting. So adults bring this virus. Safety drills is not my domain. You know, we speak to it brief. You still need safety drills, definitely fire drills. But I would encourage you to go to the guidance. We did address it. I just don't recall. There are some that are still required. Will guidance for preschool within an elementary school be different than older students? Not really. I mean, the secondary question here is about the touching and the how diligent to be. So that the guidance is try to be apart 6 feet. Everyone should wear masks. And little kids actually do better with masks than they do with distancing. And that's okay. So you really do, if you have childcare providers in your world, you need to talk to them because they want to tell you what this has been like. March, April, May, June, July, they've been doing it. They do have kids in their lap. They do touch students. They have to. They're caring for very young people and they are diligent about their hygiene and the hand washing and their masks. Can one full grade level be out on the playground? Can 60 first graders use the play structure together? Do they need to stay in smaller classrooms? Okay, so group size is a super important nuanced part of our guidance. It is better to be in a group of 25 because it's less exposure, but it's especially better if there's a case because contact tracing 60 people is a lot more effort and a lot more people that have to quarantine than 25. So there's a nice moving line here where if it works and you got to get a bunch of kids outside at the same time, you can. There's nothing prohibited in our guidance about bringing groups together or expanding beyond 25 students, but there is a consequence if there's a case, which is it's more people that have potential exposure. So a lot of this is nuanced, and I know it's hard. So you can, it just has, you have to think about if you got that phone call that someone had COVID, who was in touch and who would need to be interviewed as a close contact. I'm going to do a quick time check. 3:09. And Soph and Clayton, and please interrupt me if this isn't, if you want me to do this differently. I'm just going to keep trucking. Okay. Can we be allowing elementary students to play games when they're not distancing but wearing cloth? Yes. Well, let me start over. The creativity and the innovation that needs to occur is to set games up with distancing, recognizing that it will be imperfect. So kids definitely move toward each other, and then we remind them to move back apart. So this sort of health behavior change that all of our kids are experiencing just needs really solid adult modeling. So we can't say don't do it or you don't have to worry about it, but if they start drifting, it's not a punitive situation. There's no discipline. This is about reminders. If desks are facing the same direction, can be they less than 6 feet apart. So stay tuned. This is all part of our, what we're trying to address in the revisions. My district has all grade levels opening stage 2 hybrid, and half the students are all building at time, AAP. So I think this showed up in 2 places. I believe we answered this. Can special ed services be provided to students from different cohorts at the same time if they're outside and spaces allowed? Yes. So we are really aware of the needs of kids in terms of speech, language, OT, PT, and also that some of the richness of education around, art and other sort of special aspects, people that move in, that come in and do work with different groups. So there's nothing prohibited about that. It just needs to be named and and kept track of. So if there's two groups of special ed students together doing something, we just need to know that that group was with that group in an attendance way in case there's a case. I'm gonna just pause and see if I'm still, am I still good, Clayton? Keep going. Okay, because I had to minimize faces so I could see my slides.
No, you're good. You're good for now.
Okay. What about sending student staff with any COVID symptoms to isolation? Okay, so let's talk about this. I mentioned this earlier, so but I really want to restate it or keep stating it. Pre-COVID, we had a lot of wiggle with illness, and people didn't feel that great and they came to school, staff, teachers, kids. And they came back early. They went home really sick on Tuesday. They were back Wednesday morning. We are so acutely aware as health professionals now, as you all are, that that was not good infectious disease practice, but we had grown into a reality over the last 20, 30 years that that sick people had to be out exposing us because of the way our workplaces are set up and the fact we don't have paid leave. And so all of that being said, that is completely different now in a pandemic. This is a pandemic. No one sick can be in school. And if people get sick while they're in school with any symptom associated that could be COVID, they have to be isolated. So that part I know for sure. The harder algorithm is when do they come back. So this question about exclusion for 10 days and the doctor's note, that all needs to be addressed in this algorithm I'm going to work on with pediatricians at 3:30. And the reason I want to state this so clearly is adults are going to have a different algorithm than kids because kids don't get COVID. It's like less than 1% of the kids that are going to go home with that long list of symptoms have COVID. So but we can't send everybody back instantly because it's still a pandemic. So there's these three buckets. Is it a kid that gets tested? Great, we'll know the results. If it's someone that we really think might have it, which is usually because they've been exposed to an adult who has it, they need a certain set of circumstances to return. Or do they just have a cold and everybody has a cough and they got better in a day? When do they go back? And we're working out that when they go back, because we don't want you in the center of these very nuanced decisions without solid algorithm. Parents are going to be frustrated and children are going to miss a ton of school. I could not agree more. The pediatricians are driving me crazy. They're my great friends, but they're saying it's too much work for you to call our office with all these questions. No, it's not. Like, this is going to be a ton of work for you, for pediatricians, for public health. You know, the health commissioner hasn't had a day off since March 8th. You know, maybe you saw the article about him in the paper. So let's all recognize it's short-lived, hopefully, but it is going to be a lot of communication of people going home and staying home till they're well. On page 8 it says students who travel outside the state must follow the quarantining. How would we be requiring, or would we be requiring students and staff to follow the same guidance from the health department if the families traveling out of the state for extended periods of time? Okay. Quarantining is one of the hardest, most interesting travel quarantining parts of this response. I need to know the specifics of what you're asking here, because if you travel to a state that is not on the map for the Agency of Commerce and Community Development for safe travel, then yes, you have to quarantine when you get back. And that's true of healthcare workers, it's true of teachers, it's true of students. There's no way around that. We're not allowing people to go to Texas. And I'm sorry I keep calling out Texas and Florida, but they have very high rates of virus, and come back here without quarantining. So we've had some very interesting questions from some of you about, we have a lot of borders in Vermont, Massachusetts, New Hampshire, New York. What if your teacher lives in a town in another state that's red on the travel map? And we have asked that of our, really the governor's team, and we haven't gotten an answer back, but we don't know what to do about that, because even essential healthcare workers are not allowed to just wander from red zones back in. So stay tuned. I hope you all have that page pinged on your desktop. It's called like cross-state travel. It's very specific and it changes every Friday based on data. What about, oh, uh-oh.
What's going on?
I don't know. It didn't advance. Oh, it says my Zoom is unhappy. Okay, so I'm gonna, can you still hear me?
Yes.
Okay, I'm gonna reboot.
Which slide was that? If you can just tell me the slide, I can bring it up.
18.
Thank you.
Slide 18.
See, Clayton, it's good we had a backup plan. Let's bring up slide 19. I finished 18. And I can't see the Zoom anymore, so let me know.
Yeah, hold on a second.
I can
Okay.
share mine. I don't have it yet, but whoever gets it first, Clayton.
Thank you for your patience. Sorry.
So I'm now on slide 19. Hopefully everybody can see that.
Excellent.
Yep.
Okay. So I guess I shouldn't try to connect too. Do you want me back or just do what I have to do here?
So I just reconnected you. So if you want to keep going, if you can look at just your PowerPoint, you should be able to talk through and I can change slides for you.
Excellent. Thank you. Okay, so when discussing with local providers, students who are sent home with symptoms of potential COVID, providers say they can't see and provide clearance for every patient. So that addresses what I just said. I hear them that they can't see everyone, but there is going to be a pathway where we need them. It's not everyone though. So I'm kind of getting out ahead of this afternoon meeting, but I really want you all to be my thinkers on the group that need the medical home and then the group that can come back with your expertise because you are medical professionals as well. The symptom-free for 72 hours has some traction. It might be in this algorithm, so I'm gonna leave it there. Acknowledging, I love the word art. You know, there is an art to symptom management. I'm so grateful that you're critical thinkers and that you're nurses. See, in childcare, we don't have a robust system of health and safety advisors. You know, that's best practice to have these great nurses that support childcare. Some of you did that role, but we don't, it had to be a lot more just exclusion till better, but you guys have, you know your students and you can say this kid has asthma and he had a little cold and now he's better. I'm looking forward to that nuance. So what constitutes when a student is considered sick enough to stay home? So stick with me on this because this level of detail is coming and I promise. Should children with one symptom be referred or should they have several? Yeah, I would say that kids have to be pretty sick and have several symptoms to be considered, but that's only if they haven't been in contact with someone with COVID or traveled, or I want to give myself the out there that there's a subset of kids with minimal symptoms that would still be at risk for COVID based on exposure. Okay, next slide. Will there be clear guidance on when to send students home? Everyone goes home. So this is really important to me, that sick kids go home. And what I know you've been asking beautifully nuanced question. What about Johnny has a migraine? So if you know he has migraines, he doesn't have to go home. I mean, he probably will want to go home if it's a migraine. But there's a subset of kids with chronic disease or known conditions that you will know that don't have to go home. But everyone else with illness, stomach ache, one bout of diarrhea, a fever of 100.5, home. And all schools will be using that same parameter. This is why we need school nurses everywhere. The AOE documents safe and health guidance for reaping lists a significant rash as one of the exclusion from school. There's no mention of nausea. Yes, we added back diarrhea. Thank you for noticing. So the infectious disease doctors wanted diarrhea off in Vermont because that's just such a, this was for childcare as well, such a pediatric symptom. so low on the list of COVID-associated symptoms, but it wasn't working to have different symptom lists for websites, adults, kids, and we just opted that every list has every symptom. I find this very complicated because the list is long that might be associated with COVID, right? And you guys know what's ahead for us in November, December, January. This is going to be really hard, but it's a great opportunity to advocate for flu shots, because if less kids have influenza, less kids will be in this algorithm, right? Do we as nurses have the ability to assess? And yes, but please don't find yourself in a cavalier space that you're sort of that, you know, that clinical feeling in your squishy stomach, like I'm sure this isn't COVID, but, right? Because this is an extraordinary time, so that I wouldn't want you to feel any pressure to think it's just not COVID, you know? I feel like you have the critical thinking skills to say, I'm sure it isn't, but you can't keep this kid in school for X, Y, or Z reason. Okay, next slide. How do school nurses triage COVID symptoms as outlined in Vermont Return to School and decide whether to dismiss the student or not? Okay, I think I addressed this, but new headache, new symptom. If you know it's hunger, then I really trust your judgment on that. But if it's a kid that's you've never had before with headache, has a new headache, he has to go home. Can students or staff with a history of migraines need to leave school? No. So that's that great example that if you know your students have migraines, they can rest. And next slide. I think I can do a few more.
Right. You have 7 minutes.
Okay. What is the timeline for coming back to school following a positive COVID test? Okay. Return to school after, or work or life after COVID is completely outlined by the CDC. We have no wiggle on that. And it's different if you're tested or not. And we don't, meaning repeat testing. And I want to be clear, we do not recommend a repeat test if you've been positive for COVID. And that's because PCR tests for people with COVID have been shown to be positive for up to 60 days after the illness. So in Vermont, we do a symptom-based return, and it's not in front of me, but it's very specific. It's like 72 hours without fever and 10 days since your symptoms started. And it's all just in the lane of if you had a positive case, which is going to be so few of your kids. What you're going to really need better support on is there was no test, or there was a negative test, but the kid still doesn't feel well. For return to school using test-based, will only PCR. Okay, so I think I just addressed that. No test-based strategy for return to school. And please understand that PCR testing is the gold standard to pick up this virus. And we could talk about that on a subsequent call. Are there guidelines for when to close classrooms or buildings? DT.
Due to?
What does DT mean?
Due to?
Oh, due to positive testing among staff, yes. So if there's a positive case, you close the classroom and you try to wait a day and then clean. But big conversation nationally about this. Most schools are not going to be able to close for a full day. And the infectious disease doctors say just wait a couple hours and clean. So I think that answers your question, but it is never going to be the building. It's going to be very contained to a certain space in your building. Never going to be the whole building. Okay, we'll do one more. We're looking for clarification on the isolation room. Is it one person only? How do we decide? Okay, this is going to be hard and difficult. Yes. Every sick person needs his own room or space. And there's a way, and Sharon Lee is good at this, with partitions and certain types of mechanics to get people separated in a way that doesn't spread the virus, but still be in one, what you would classify as a room. So I'm sure you're imagining a time this winter when you have, well, teachers that get sick can presumably get themselves home, but that you have several students that are all in isolation. And what I would say is, again, it's a pandemic, and it may mean you got to kick people out of rooms and get kids just for that day to go sit in a room while we're waiting for his parent. So regular virus, influenza, strep, all the sick people need to go to isolation because we don't know what they have yet. The people that will be in your traditional health office will be first aid, medication administration, kids that have chronic disease that you know with asthma or others, and everybody else that comes down that doesn't feel well needs to be set aside, put aside. And Sharon Lee is really good at this because she knows how to do like doors and curtains. And what symptoms would constitute an appropriate use of an isolation room? I think I just addressed that. And then will there, I can't see because the chat's in the way.
Will there be using standard, will we be using standard isolation room procedures that all Vermont schools will follow?
Yes, if I'm understanding the question, it is required that schools have adequate isolation space for illness. And in between student use, we're currently saying an hour. And, let me make that distinction, because if the person ends up that they had COVID, we won't know that real time. But again, the kids aren't going to be the ones with COVID. It's your adults. It's a rare event to have a kid with COVID.
And Dr.
Do
Holmes,
isolation rooms need 4 walls? I think, yeah, I just wanted to make sure folks knew that you've got expertise in Sharon Lee about it's not a curtain, but there are kind of folding situations that can turn isolation rooms into that a few people could share it without spreading the virus. So I'm going to stop there. We made it to slide 23. I think we probably have 5 more slides or so. That's not.
yeah, we have 5 more.
Or
6.
Or 8. So really, apologies for the time, but I would love to answer the rest of the questions. Either we can do this together in writing, or I can come back to another town hall and keep going if this is helpful. I just wanted to end by, I know you're all staying on, I wanted to end by saying that we're very much here for you, and we know this is hard, and I want us to just get started. Because what childcare and summer camp taught us is once you start, you see which parts are harder and which parts are easier. Just to stay strength-based here, there are parts of this that aren't as hard as they sound. I know it's very daunting, but it's a lot about behavior and the way that we are shifting as a society. We're better than we were in March, and we've learned a lot from our childcare and summer programs. So I'm going to sign off, let your group, you can keep going, Clayton, because I think Sharon Lee knows a lot of answers as well, and I'll be back whenever you invite me.
All right, thank you.
Breena, thank you so very much for your time, and we will be inviting you back. Thank you.
Okay, so Sharon Lee, I think we're on slide 24.
All right. I see a lot of thank yous in the chat box for Breena. There's a lot of appreciation. It's a really hard thing to do when it's so, unnerving, and this is a path that we're sailing and there's no map. So appreciate that. Especially, there's a lot of people on that task force that have been volunteering their time, meeting with teachers, meeting extensively with a lot of different groups. And it's hard to be in front of the public in a, kind of nerve-wracking situation. So questions. All right, gonna make me get close. It may not be possible to clean large playground structures between use. How important is it is reclined. So clean what can be cleaned. You know, a lot of wood, it's not going to be cleaned. If you've got some metal railings that are easy to clean them.
I'm sure if I'm sorry to interrupt, but Douglas Kane brought up a pretty good point, and maybe since Dr. Holmes just mentioned about the isolation rooms, and you have some strategies, maybe you could speak to that a little bit, because that might help some folks understand, and then we can maybe get the rest of these questions answered, maybe in writing or something like that, unless there's time at the end.
That's great. I love that she has all this confidence in me. I'm learning as adding planks to the ship as I build it. But I have worked with some national folks and working with the docs, the ID infectious disease docs that are on the task force. So we ask a lot of questions through them. Isolation, what I'm seeing is really, how do you share a space? It's the 6 feet. How do you keep 6 feet distance? And these kids and people need to be wearing a face cover. Can you put a clear curtain in one of quote the walls so that you can see to the other side, but then that has to be wiped down when it's done. I want to write a protocol for isolation with my other colleagues. So I don't have more details on that. I think one of the wisest things was the Swiss school nurse that we all heard, who said, you got kids in your classroom that you think need to see me? Well, they'll just have to, you need to call and find out if there's room and what are the symptoms. And I saw these questions further on. I don't think we've gotten to it yet. This is, what are they going to do when you can't do your job? So every room needs to have a space that they can separate individuals who are not feeling well and make the appropriate call to the health office and to find out who and how to proceed from there. And that's something every school is going to have their own one. If you want to try some specific questions about isolation.
No, I think that's good for now, and maybe capture that in the future. If you want to just go back to the slides, I think you were on bullet 2, and we can just start moving forward from there.
Thank you.
Thank you.
Yes, it does need to be a room. There should be outside ventilation, and questions will come. I'll just follow the questions here. Send a child home with a fever or other symptoms. Do we need the classroom? You clean any space where somebody was ill. This again goes back to the general public health guidelines. But that's again where if a child is not well, they're going to one spot, designated spot in the classroom. And that's the part that gets cleaned. And sanitizing, so you all know the difference, right? Sanitizing. So first, everything has to be cleaned. And then if in childcare, if it goes in your mouth, it's sanitized. If it's something you touch, then it's disinfected with a separate product. Page 13 says all staff should be trained in proper cleaning and disinfectant. So that's a great question for your facilities manager. I've been working off and on with VSVT, Vermont Insurance Trust, Vermont School Boards Insurance Trust. And they are doing a lot of training for facilities folks. There's all kinds of workshops that are free. I've taken a couple of them. We have a lot more sophisticated information, so we could guide some of the questions, but they have that training. They have access to that. And all of the products that are used, every product has its own materials, or MAT data sheet or MST. It's a materials data sheet that describes how to use it appropriately. Water fountains. Yeah, let's skip over that. Our party line is just wash them frequently. People need hydration. And if you want to carry and worry about various paper cups getting spilled and people losing their water bottles, I mean, it's a decision that your team will have to make. Should we have rescheduled water breaks? Sure. Any schedule that you can fit in. Okay, next slide. That's fine.
Okay, sorry about that.
Guidance on wait time to clean. I think you heard the hour. Solutions for poor ventilation. So there's been a whole team working with that. You should work with your LEA and your superintendent and your facilities manager on what those ventilation recommendations are. I can send more content out in the bulletin. It's very complex, but I think you can digest it easily. But every space has its own math, and it gets there's a lot of nuances to it, a lot of pieces, a lot of moving parts. So I would really encourage them to work with, again, VSBIT. I know they have resources on that. There's a webinar that the EPA, US EPA has webinars, free webinars on how to clean schools and how to ventilate for indoor air quality. So those resources are all there. And can you use fans? So there's great fan conversations been going around. And if you're gonna use a fan, you're not gonna put it behind the sick kid and blow it across the room. You open the window, put a fan to the out window, put a fan coming on the other side, blowing cool air, clean air in. Our ventilation, our industrial hygienist is really good at saying it's about clean air. As much safe, warm, comfortable air as you can get into and then out of the building so it's air turnover. That's key. Vision and hearing screening, great question. I doubt it will be waived. It's more, there's a lot of creative ideas on how to focus on the priority kids. And when you can get to it, I don't think there's going to be a lot of discussion. There will be written guidance. Immunizations, yes, the schedule will not change ever because there's no medical recommendation to do so. That comes from a much bigger national, international group.
Sharon Lee, one of the questions, and maybe we should address this in the chat box.
Somebody needs to mute.
So one of the questions in the chat box was about the resources. You referenced resources a couple times, and they're asking where they can find those resources that you're referencing.
Which?
I'm unclear. I don't know which one, but you mentioned about some resources, and I don't know if it's on the Department of Health website.
Ventilation and indoor air quality, go to the US Environmental Protection Agency and Google, you just put in school and vision program, school indoor air quality, EPA, and it'll take you right to Schools for Tools and their latest on COVID accommodations. I'm not sure what other resource, VSBIT, yep, so Vermont School Boards Insurance Trust. So you can put that in Google and go right to it. It'll take you to their website. They changed their name. I spell it out because so you'll know what it means, but it's the School Boards Insurance Trust in Vermont, where most schools have their risk management insurance.
Okay, Sharon Lee, I think we're going to stop the questions there.
Yep.
And I think we've got some more that came in the chat box, and I also think that some of the things we've talked about. So when we try to answer questions and get those out, obviously, and we link those on the VSSNA webpage. So the ones that we're able to answer soon, we'll try to get those up. If we can get the links to the resources that we're being asked about, we'll also put that on that document so that you can get to those. There was a document released by Harvard, can't remember the exact title of it, that provides a lot of very good information about facilities. And I'll definitely get that link out. I have too many things going on my computer right now to get that out, but we'll get you that link. Dr. Holmes had said she ran that by the environmental folks within the Department of Health, and they said use that document and share it widely. So we will do our best to get that out. It has lots of very good information. And there was also a memorandum that was posted on July 28th that might be today or yesterday. I'm really confused about days and dates. And it was on the Agency of Education website, and it is about school safety drills guidance for COVID-19. So that just came out recently. So if you go to the AOE page and look, you can grab that one pretty quickly.
So I can tell you about that too.
Yeah, so I think, and we only have a couple of minutes left. One thing, so I'm the director for National Association of School Nurses for Vermont. And I wanted to let everyone know that today at approximately 3:50, Donna Mazik, the executive director of NASN, is going to be on NPR. And so I'm thinking about lots of different things. So if you want to tune in, Donna will have, I believe, some very, very positive things say about school nursing and what's going on right now. And we would love for people to listen into that. And then we need to share that out so people know what school nurses are doing nationally. And then, of course, what we're doing here. And then I'd like to turn back over to Soph.
I want to thank all of you for being here. We're all kind of in this together, and we've never been here before. So one thing I'd like to encourage each of us to do is kind of take a deep breath sometimes when you get asked the same question the 27th time in the last 15 minutes. Or however many times those questions get asked. We would like to continue with town halls. We'll be sending out the invite and working with all of you as we continue to move toward the reopening of school. I know there are so many questions. And when Dr. Holmes was referring to the guidance, we all want that guidance yesterday. Actually, we really want it last week. And
2 months ago.
Exactly. So recognize that this brand new virus that we are all dealing with, things change every single day. And I just really appreciate the competence that you all have and your willingness to work together with all of us, with other school nurses, so we can figure this out and so we can support each other as we move forward. If you're not already working with the other nurses in your school district, please reach out to them, even adjoining school districts, because we all are going to need the support. And we are so appreciative of all that you are doing and all the time that you've been volunteering through this summer as we continue to move forward. So continue to send those questions to COVID-19@vssna.org. We will get as many answers to you as quickly as possible. And tune in to Donna Mazik on NPR.
And I did put the link on the Facebook page for VSSNA Facebook page. So if you go there, that'll drive you to the piece that's going to happen. But I think it might be live.
Okay, terrific. Thank you all very much. Enjoy the rest of your day.
Great. Thank you, everyone.